an induction session being planned for you and Abby. So with Abby and you, I think what we are looking at is obviously getting onto a bit of a course induction with us. And that course induction will allow you to understand the delivery, how will it happen, and basic other important aspects of things like assessments, things like the feedbacks, how you have to send things over on email. So those are the bits that we are going to be obviously doing the discussion on the induction.
Okay.
So that would be planned. If you check for an email which I've sent and respond back to that email, reply all, because Jill will pick it up and she will then schedule a Zoom session which will be sent across for the purposes of obviously doing an induction. It'll be a 45-minute induction leading to you getting a bit of a demonstration of the learning platform, how the resources are organized, how you need to study. A bit of a suggested study plan will be discussed, and a bit of an overview in terms of team and people that you can get in touch with regards to studying this course. Okay, so let's start a bit of a discussion on our learning outcome 2 that we're going to discuss today. I've got a couple of learners which are already on. So thanks for joining, Abby and Chi. Thanks for joining in. We're going to continue our journey on the learning outcome 2, which is to discuss basic things around what is equality, diversity, and discrimination. One of the key aspects that we look at when practitioners in health and social care actually provide services or obviously care services to members of the public. One of the things that we have to look at very clearly is that we need to be non-discriminate. We need to make sure that we are providing services to equally to all people that we deal with. And then last but not the least, look at leave no room for any sort of discrimination, while at the same time observing diversity, because when we do provide our services and we look after patients or obviously provide care services, it could be mental health care services, healthcare services, clinical services, support services, community support services, then we do not look at, we basically incorporate into those services when we deliver the whole aspect of diversity, because every individual is different and we need to be able to respect their beliefs, values, and their culture and their traditions where they come from. So those are the bits that we're going to be discussing in today's learning outcome. There are 3 assessment criteria, 2.1, 2.2, and 3. Some parts of it are going to be looking at the various laws and legislation around equality, diversity, discrimination. We are also going to be looking at understanding how these affect and how these are implemented in terms of person-centered approach. And then we look at sources of information which can be used to provide information, advice, and guidance to individuals, members of the family members of the individuals who are undergoing care or receiving care. And last but not the least, a distinction criteria, which looks at understanding the effectiveness of initiatives which the government takes at the national level, at the local level, in order to eradicate or do away with any sort of discrimination which could crop up when these services are being essentially provided. So in order to do the discussion on this, we are going to be looking at a PowerPoint presentation. I've got 1 or 2 small activities that are planned for today, and these activities primarily have been planned in to give a broader perspective of how we would be looking at some of these from a point of view of understanding. So there'll be 1 or 2 case studies that I will look at presenting, and obviously quizzes, which will be something that we will cross-check in terms of our knowledge when we look at discussing this learning outcome. So let me switch you over to the presentation slides. So I hope everyone's able to see the screen clearly and hear me okay. If you do feel that there is any distortion or if the screen does not refresh, then what you have to do is let me know so I can basically share and unshare the screen once more, and that should allow us to do away with if the screen gets frozen or things like that. As always, just one simple housekeeping tip. When you're not asking questions, please keep your microphones muted. By all means, participate in the sessions, ask me questions through the chat route or through the unmuting of your microphone, and I will be more than happy to discuss and provide information If I can't do so during the session, I'll probably, email you or provide that through the handouts on Moodle. Now, when we look at person-centered approach, just a quick bit of recap. Does anybody remember what are the 7 values of person-centered approach that we discussed yesterday? Anybody? What are the 7 values of person-centered approach?
Yeah, sir. Individuality, rights, choice, privacy, independence, partnership, dignity.
That's correct. Yes, that's great. So these are some of the person-centered values that we will come across time and again in this particular unit. And then we looked at the approach of how the PCA approach came about. So who was the psychologist who essentially introduced this approach, and where we see the beginnings of this approach coming across into the National Health Service? That person's name, by any chance, anybody remembers? So we had Dr. Carl Rogers, or the psychologist Carl Rogers, American psychologist, which basically introduced this as a concept. Then Engelman, basically, Dr. Engel essentially introduced this into the Institute of Medicine, later on becoming a centerpiece for the American policy, and then Lord Darzai's report and Newham's report, which was initially started, or basically tabled in the early 2000s, later on led to the adoption of person-centered value of PCA approach into the National Health Service. Now, today we are looking at a couple of things. So let's look at understanding the meanings of these terms first. What do we mean by equality? So obviously the term equality means we are in a state of being equal. That means every individual is considered equal in the eyes of God. And obviously when we look at equality, it basically shows that we do not give any credence to caste, religion, gender, while discussing, or while obviously looking at things or evaluating at things. So when we in general talk about equality, we are looking at making sure that essentially every individual gets equal status, or say, for example, equal attention when it comes to essentially looking at providing care. Now, it can have a very broad meaning as well, because when we talk about the concept of equality, we are looking at that all individuals or groups or people within groups have the same rights. They should get the same opportunities. They should have the same treatment being provided without any concept of discrimination coming in by considering factors like race, religion, gender, age, disability, or sexual orientation, or any other personal attributes do not need to be taken into account when we essentially look at equality. And in the context of equality, when we talk about, we are basically looking at equality in the context of health and social care. So we are not looking at equality in general. We are looking at equality in the context of health and social care. So when we look at equality in the context of health and social care, which means that we are going to be providing care, and that care which is being provided to individuals within a particular setting is going to provide equal opportunities regardless of the background, abilities, lifestyle, whether you're rich, whether you're poor. It won't be taken into consideration. And this would be the state of equality when we talk about the concept of equality, when we talk about in relation to health and social care services. That means if I'm a practitioner, if I'm a nurse, if I'm a doctor, if I'm a health and social care worker, and I'm required to treat people, I'm going to treat them alike. I'm not going to look at discriminating or look at their culture, background, race, religion, and then decide what kind of a care I'm going to provide to that individual. That would basically amount to discrimination. So here, everyone is given equal opportunities. And in this case, equal opportunities would be from a point of view of helping to build certain, bridges. For example, if I have a disability, I can't see, I'm blind by birth, then in those cases, one of the things which has been introduced by the government is Braille. And when you see Braille language, or the dotted sign language, which is on most of the ATMs when you go, or on the medicine packaging, or on certain types of instructional leaflets, and sometimes when you get a flyer or a poster coming through the post. It also says that if you need, if you are disabled, if you need this in a printed braille format form, then you can ask for this from the council or ask from this from the local authorities. So that is an example of how inclusion or people are being treated equally by ensuring that the information from the NHS National Service is available in different formats, which means in formats like braille, people who are not able to see, and that would be saying and using the true meaning of equality as far as that is concerned. Now, what do we mean by diversity? What do you mean by the word diversity? So when we talk about diversity, we are looking at basic bits, which basically mean that every individual is unique, and we recognize these differences, and these differences can come from age, gender, race, religion, your socioeconomic status, your religious beliefs, your ideologies, your political belief. And this would be in the wider preference or wider consideration of that everyone is different. And when we look at diversity, meaning of the word diversity, if I look at, just the meaning of the word diversity, what I mean by that essentially is that everyone is a bit different. Everyone has different practices, different beliefs. And because you have different practices and different beliefs, that would create identity for an individual. And that would essentially mean, in very simple words, that people come from various backgrounds, they have different lifestyles, they have different experiences and different interests. And having this large variety of individuals represent as a group would essentially mean diversity. So obviously, when I look at the National Health Service, the National Health Service in the UK, it is quite diverse. It has maybe 50 nationalities of individuals working within the National Health Service. There are people from all different backgrounds which are working within the NHS, and that goes to show that NHS is an employer which believes in diversity. That means they are able to employ individuals from different backgrounds, different cultures, and that shows inclusion within the company or within the organization. Now, the third important concept that we come across in the learning outcome is discrimination. So when we talk about discrimination and when we say, meaning of the word discrimination, what we are essentially referring to is we are referring to the fact that if you feel that you've been treated in a different way or unjust way, or you're treated because you come from a different background, or you have a different color of the skin, or you have this disability, and if that is seen as let's say that is seen or used as a tool against you to say differentiate and say that this is not done or this is not possible, or you cannot get this, then that would be seen as discrimination. But in general, if you look at the definition of discrimination, it refers to that people are being unjust to you, they are being prejudgmental, they are treating you differently on the basis of your characteristics, your attributes, or certain beliefs. And this treatment, which can be termed as unfair treatment, if I put it this way, is going to be used to discriminate against you. And this part would, if this is to happen, that they take into account, for example, you go in for an interview and they see you that you are from a particular race, you're coming from a particular country, and they say, okay, no, we don't want people to work, work into our organization from this particular location or this particular, background, then this will be treated as discrimination. What kind of discrimination? Racial discrimination, or discrimination on the basis of your race or nationality. If they see that, okay, sometimes when we see adverts of job interviews and they say, okay, like a company is advertising for a role of a receptionist or an administrator for the office, and they mention in the job description that female candidates only apply, then that will be seen as a discrimination, because what you're doing is you're unfavorably looking at only allowing females to apply for this role, whereas males can also be qualified and have relevant experience to be able to apply and make it for this role. So if this is an advert put out by an organization wherein they say female candidates only apply, then this would be seen as discrimination on the basis of gender. That means you're being gender biased, and what you're doing is you're essentially allowing people, not allowing people from one gender to be able to apply for those, for those vacancies, and that will be treated as discrimination. Now, one of the last pieces that we want to look at broadly would be to understand how can information and advice be provided to people within the National Health Service, or practitioners like nurses, doctors, healthcare workers, occupational therapists, even somebody like dinner ladies, administrative staff, or contract workers which work within the National Health Service. How would the information be provided so that you do not discriminate on the basis of any sort of race, religion, gender, ethnicity, and things like that. And you always understand what is equality, and you also understand what is diversity. Now, this can be done very briefly as an overview, done through, say, so various sources of information can be provided, and this information could come from your manager, it could come from co-workers, it could be from training, it could be compliance related, legislation from the Care Quality Commission. It could be coming across from your local authority or professional bodies that we know of, like the Royal College of Nursing, the British, BMO, Medical Association. There are 16 such associations in the health and social care sector, the Healthcare Professional Council, HCPC. These are professional bodies which will put out information on equality, diversity, and discrimination, so that if you read and go through some of this documentation, you'll be more aware and you'll understand how to deal deal with these issues. Now, when we look at these particular bits, what we are also going to be looking at is discussing just a minute, I think Grace. So basically, in this case, what tends to happen is that you would look at these pieces of information which are required, and these pieces of information would be useful for you to understand the concepts of equality, diversity, and obviously root out discrimination if it is something which is being done or observed, or you are seeing this happening within the organization. Now, in order to understand the basic aspects of what is the concept of equality, diversity, we need to look at maybe going into a bit more detail. So equality, as I mentioned earlier, means equal rights and treatment for all individuals. Diversity means difference, which is basically expected, because people come from different backgrounds, cultures, they have different beliefs and values, and that is where diversity comes in. Now, what we need to be able to do is understand them in a bit more detail. So when we say diversity, and if you look at the various ways through which diversity can be observed, is diversity can come across by looking at some of these key characteristics. These key characteristics would be things like race, culture, your origin, nationality, your region, or in large countries or geographies, sometimes you'll have regions from which different people come from, and the culture of that region seems to dominate the personality of the individual. And there are bits which we are aware of: gender, sexual orientation, age, marital status. You have religion, ethnicity, disability, ability, health, value, and politics. And lots of these features can be looked at in terms of when we talk about diversity. Now, in order to go into a bit more detail, we are going to go into the assessment criteria, because some parts of this is covered in the first assessment criteria, which is 2.1, and it talks about the concept of equality, diversity, and discrimination. Now, one of the things which I want to look at is understand this part 2.1 using a bit of a case study. So I'm going to share that with you right now. And what we want to be able to do is primarily look at understanding this particular, case study, and look at this to discuss the concept of equality, diversity, and discrimination in particular. Now, the first case study I've got talks about supporting an individual with disabilities. So we will look at discussing this and then discuss relevant legislation around equality, diversity, and discrimination to cover some of the assessment criteria. Now, what does the case include? It talks about you're a healthcare worker. So assume and wear the hat that Ashu, Grace, Abby, Chi, Fatima, most of you on the session are all working as healthcare worker, and you've been assigned to provide a person-centered approach to a client named Sarah. So Sarah is basically the patient. She is on a wheelchair and has limited mobility. She wants to join local community group, but she's concerned about the accessibility and acceptance of herself because she feels that her disability kind of deprives her in terms of confidence and the ability to be able to join the local community group. Now here, with this background in mind, what we need to be able to look at is explain how can you ensure equality, diversity in person-centered approach for Sarah, considering her disabilities allows her to participate in or join that local community. What are the various legislations that support her rights and address her potential discrimination? Also, we need to be able to suggest what are the sources of information and advice that she can get, maybe from the local authority, maybe from let's say the community welfare provision within the local authority to understand what are her rights and how she can go about getting accepted or getting to participate in this particular the local community group. So what I could do is, what we need to do in this particular case is understand and be a bit more creative in terms of understanding what could be the hurdles that she could face as she's a wheelchair user and she has limited mobility. And how do we relate this to what is called person-centered values or approach, and see what legislations or what information she can glean or lean on to understand and be confident that she can be accepted in the local community group. So as a healthcare worker, so for example, I'm a healthcare worker and I assume that role, and what I would do is basically look at Raman as a healthcare worker and I'm being assigned to take care of Sarah. And what I'm going to do is basically start the approach. So I'm going to explain the first case to you, and then we'll look at a second case wherein you guys will discuss. So first case is, I've got Sarah, who's my patient, and what I need to be able to do is support her because with her disability, and also ensure that she's confident and she's accepted into the local community group she wants to join. Now, how would I approach this? The first step that I'm going to do is I'm going to understand exactly what Sarah is interested in and what is her concerns. So I know that her interest is in joining the local community group. Her concerns are that because she's on a wheelchair and she has limited mobility, she feels that there would be a hurdle, mental hurdle, or maybe has low confidence that she would not be accepted or she would not get the cooperation from other people within the community group. And in her case, what would help me, Raman as a healthcare worker, would be to look at why she wants to join the local community group, what is her interest, and knowing her preferences will enable me to open and discuss with other members in that community group to provide opportunities which are going to align with her interest. So that's the first thing that I'm going to do as a healthcare worker. The second thing which I'm going to look at is try and find out. Now, this is where legislation comes in. Sometimes you go to public offices or public buildings, local council offices, you would generally see a wheelchair access icon being installed outside. Now that shows that this building is wheelchair accessible or wheelchair friendly. So one of the things which I would look at as a healthcare worker would be to look at accessibility options. That means I would identify whether the areas or the places that you would need to access under the local community group would have the accessibility option for wheelchair or not. Are these facilities available or not? And I would basically discuss and ask questions which would basically allow me to understand which all entrances or restrooms or areas within the local community group where the office is or the building is, like for example, parking, have disability, area are basically disability friendly areas, which means wheelchair friendly areas, things like parking, entrances, is there a wheelchair ramp available in the local community group office, yes or no? And those are the questions that I would ask. Now, as a healthcare worker, I would also do a bit of advocacy. That means if the group does not currently have these accessibility options or options available for her to be able to access those areas, then I would discuss with the local community group possibility of making appropriate modifications. Now, these modifications might not happen overnight, but I would draw their attention towards the Disability Act and then say that there are similar areas or options available wherein the local community group could try and make accessibility much more, to the facilities much more easier for people who are on wheelchair access. Similarly, I could do lots of other things. For example, I could also discuss, let's put it this way, encouraging participation of Sarah into and being accepted by the members of the local community group. So here I might have discussions with the local community group here to say we need to believe in inclusion, we need to have opportunities available for all, and I would basically draw their attention towards bringing their knowledge up in terms of educating them to say that we need to be able to provide equal opportunities to people with disabilities as well, and that would put let's say a bit more focus on how she would be accepted for membership within that local community group. I might speak to some influencers, some key people within the local community group organization, like a president or a trustee, and say that these provisions need to be created or made available for people like Sarah who have wheelchair access or limited mobility to be able to join the group and feel confident in joining the local community group for participation or other reasons. And these are things which I would do apart from keeping a regular check-in on how Sarah is doing after she's joined the group, maintain regular checkups or check-ins with her, essentially to ensure that she feels supported. And this would also, give me an idea that how and what is she experiencing, and if she needs any further assistance or accommodations, then I would be looking at speaking to the relevant person within the local community group to ensure that these needs for Sarah are essentially met. Now, if I follow these, through and through, then I would be looking at obviously providing person-centered approach or support in this case to Sarah and making her dream of joining the local community group possible. So if I were to summarize, what all have I covered, in ensuring that Sarah gets accepted to the local community group that she wants to join? Say, for example, she wants to join the, local association, for, let's say, tennis professionals. And what I have ensured by following things like being an advocate for her case, or, making sure that accessibility is, people are made aware of the accessibility requirements for people who are have limited mobility or challenged by disability, and then also understanding Sarah's interest and concerns about why she wants to join the group and what are the hurdles or issues that she can face when she decides to join. If I take those into account and obviously speak to relevant people, I can get her included into the say, for example, the local tennis association group which she wants to join. And that would be looking at what is called person-centered approach. Is that okay? Any questions on this? So we've got a number of different case studies that I want to, put forward, and these are case studies that you should be able to pick out when we are doing the assignment for learning outcome 2 tasks, to be able to put them in, and that would help you explain by an example of what is equality, diversity, and discrimination, and how we can include, use the person-centered approach to basically overcome these three different, issues, if at all they arise because of, discrimination, or because people are not considering equality and diversity from a point of view of inclusion into a particular activity, group, meeting, organization, and things like that. Now, there's a second case study which talks about, supporting diverse cultural backgrounds. So again, here you're assuming that you're a social worker and you work with a group of elderly people who come from different backgrounds in residential care. One of the residents, Mr. Patel, is from an Asian background and is experiencing communication difficulties due to language barriers. The staff has noticed that some unintentional discrimination towards Mr. Patel happens by other residents who are also living in the care home. Now, what is your task? You have to describe how can you promote equality, diversity, and cultural sensitivity in the case of Mr. Patel, and how can you educate the other residents in the residential care to treat and provide equal, opportunities to Mr. Patel and not differentiate or discriminate on the basis of his Asian background or, his communication techniques. And that would be something that you would need to look at as an example. Again, wear your creative hat and then look at what is the key part, which is what are the concerns of Mr. Patel, what are his interests, what is the relevant legislation in this case. So the relevant legislation in this case would be discrimination, which is being put forward. And then how would you educate or become an advocate for Mr. Patel in the care home and educate some of the other residents to say that they should not be looking at, discriminating against his background and his communication techniques, but thereabouts, using or giving him time to be able to adjust, or obviously, in this case, encourage him to be accepted into the group without taking it into negating into account his background and his cultural, background, and let's say, his cultural background and probably race in this case, and then look at spreading inclusion and awareness amongst other members who would then look at accepting him into the group and would not stop discriminating. So these are bits that I would suggest that you could look at primarily from a point of view of understanding some of these, legislations. Now, if I switch you briefly back to the presentation and we go into and discuss with respect to this particular example, and as I give you an example of a, wheelchair access or mobility, similarly, you need to think of one or two other examples to discuss the concept of equality, diversity, and, discrimination when we look at in the context of, health and social care. Any questions on this so far?
Yes, I would like to come in here with the discrimination with Mr. Peter, from the one from the Asian.
Mm-hmm.
Yes, with his situation. In this case, if you are a care worker and you realize this has happened to one of the service users, what will you do with him and then the other service users? I think I didn't get it well.
So basically here, what you have to do is look at wearing and assuming some of the, wearing your creative hat, and obviously assuming as a care worker, what are the ways through which you would be able to help Mr. Patel, when other care resident members are actually discriminating against him because of his background and because of the way he, has his beliefs and his, say, for example, comes from a particular background and his race and his values and beliefs. So here, in order to promote the concept of equality, diversity, and cultural sensitivity as a care worker, what you're going to do, Grace, is going to be looking at understanding first and foremost, what are the unique needs, requirements, and beliefs and background of Mr. Patel. Because as a care worker, you will need to first develop this relationship and understanding with the person to understand what are his needs, what are his beliefs, what are his specific requirements because of his cultural background. Now, in this case, your aim of understanding this about Mr. Patel is because you are going to help him communicate more effectively, and that would help facilitate better relationship with other residents in the care home. Now, how would you go about looking at doing this? One of the things that you could look at, just I'm thinking offhand, and one of the things that you could look at is if he doesn't speak English that well, and he's let's say let's say I would not use the word suffer, but he feels he gets let's put it this way, it feels as if he has difficulty in communicating because of his language, because he comes from a background where in English it might not be his first language. So in that case, one of the things that you could look at would be to look at helping by providing what are called interpreter or interpretation services. So here in this case, Mr. Patel could be, coached on getting maybe some English language lessons, or maybe an interpreter essentially could be, employed, which could help him in communicating effectively with some of the other residents in the care home. That could be one of the things that could be looked at from a perspective of providing person-centered, support or care. The second thing would be to educate, maybe I would put it this way, because he comes from an Asian background, and because of his Asian background, he might have different cultures, belief, and different ways in which he does certain things. What you're going to do is conduct some training session, or maybe a session like a get-together session with the staff and some of the other members of the care home, and educate them on the aspect of the diverse cultural background in terms of people which come from Asia. And here the training or the discussion that you do could be specific about Mr. Patel's background, and that helps other care residents understand his background and where he comes from, and that basically provides a bit of education to other residents to understand his let's say cultural background from where he comes from. That would also build tolerance with some of the other care residents, because once sometimes what happens in life is you react to certain things because you're not aware of it. But the moment you get more information and you are made aware of that this is what this is about, sometimes your aspect or the outlook of how you look at things changes. And that is what developing cultural sensitivity or training would do here. Then we would look at some of the awareness activities. It could be activities which are organized around his culture, and some of these could help celebrate diversity within the care home. And this could include, for example, maybe serving Asian food on one of the days, or maybe talking about the traditions in Asia. And that, again, these initiatives will create what are called bondings amongst various residents of the care home. And this will also build tolerance towards his culture and his background amongst other residents who are being discriminatory towards Mr. Patel. And you can think of some of the other areas, things like relevant legislation. Sometimes people aren't aware that they are being discriminated, or they are not treating individuals fairly or equally. Then in those cases, you could draw their attention towards the Equalities Act of 2010. You could talk about, the Racial Discrimination Act, in the UK of 2008, and updating and providing information about these things to other members of the care home would basically increase their knowledge, and that would mean that they would become a bit more sensitive and bit more culturally aware of what Mr. Patel's background is, and that would allow them to accept him and and not discriminate against him over a point in time. So these are bits that you have to think about, because case studies, when we talk about case studies, and the idea is here you have to jig your mind to essentially come up with alternatives which are closely going to be related to person-centered values that we have discussed. So things like dignity, independence, respect. So here, one of the things which I would say is supporting cultural diverse backgrounds for Mr. Patel would be that you're showing respect towards other cultures, and people who come from other cultures have different beliefs and values, and respecting those would be meaning respecting the individual and not discriminating. So those are bits that you have to look at. by using one of the examples of the case study to explain the concept of diversity, equality, and discrimination and how it is dealt with within the health and social care context. Is that okay?
Yes, please. Thank you.
Okay, let's look at some of the legislations now, which is basically to understand from a healthcare perspective, as a practitioner, if we are going to work within this sector, what are the key minimum legislation or laws that we need to be aware of and observe as far as the working within this sector is concerned. Now, there are lots of laws and legislations and acts within a country, but let's look at specifically towards health and social care, and some we can relate very closely to the PCA approach. Now, things like we have heard about the Human Rights Act of 1998, we have heard about the Health and Social Care Act of 2012, the Equalities Act of 2010, Data Protection Act of 1998, and now 2016 because of GDPR being implemented, and then the Mental Health Care Act of 2007. Now, some of these acts are what we need to be aware of when we talk about legislation, which would help us, or the law, which would be helping us to fight inequality, fight discrimination, and ensure that inclusion, opposite of diversity, is there, in opposite of equality and inclusion is there or practiced within organizations. So if you're aware of these acts and legislations, they help you to put information and obviously provide services in that particular context. So I've created a couple of slides for each of these acts, which are summary slides providing details of what these acts are, what they stand for, and how we can use them in the context of health and social care. So when we talk about the Equalities Act, the Equalities Act means you're treating people fairly and providing equal opportunities to people who are receiving care within the health and social care sector, or with the hospital, within a clinic, within a care home. And you're not taking into account race, religion, gender, disability while providing these services as a health and social care worker. Now, when we look at this act in particular, this act, if I have to go into detail of this particular act, essentially was introduced, when I say 2010, that means that is the year in which the government or the parliament actually passed this act. And this act then became a piece of legislation, that means law. And this act is actually aims to protect individuals from discrimination and unfair treatment in a workplace or in the wider society. I gave you an example earlier of an interview position. If a company organizes, advertises, position for a receptionist, but they put this as a line towards the end of the job advert, female candidates only apply, then this is going to be looking at unfair treatment or discrimination against males. And that could be challenged in the court of law using the Equalities Act. Now, Equalities Act looks at protecting 9 different characteristics as far as the act is concerned. It covers age, disability, gender, marriage, race, religion, sex, and your sexual orientation. Now, if any of these characteristics are considered in any way or other, and they provide grounds for unfair treatment towards you as an individual, and in general within the health and social care sector, when you're receiving care services, this would be relating to what is called the Equality Act. That means you could use this act to basically challenge and get your rights by saying that, okay, this particular pretext has been used to discriminate or not provide me an opportunity, and you can take that organization, that person, or challenge that in the court of law. Then we look at the Mental let's say Capacity Act. Now, there is a handout which I have, which is primarily available on Moodle, and that handout basically covers the acts that we are discussing in a bit more detail on that Word document or the PDF document, which will be something that you can look at. Now, when we talk about the Mental Health Capacity Act, this Mental Health Capacity Act was essentially passed in 2007. And when we look at this particular act, what this act does is that it provides a legal framework for an individual or an individual who's acting on behalf of somebody to be able to make decisions on that on behalf of that particular person if they lack what is called the mental capacity to be able to make decisions themselves. Sometimes an example here I would give you is sometimes what tends to happen is that you see individuals which become incapacitated, So when you see sometimes when individuals become incapacitated, say, for example, because of an accident or an injury, and they are not able to, decide what is right from wrong, or they're incapacitated because they're not able to make any decisions. So in those cases, family members of the person affected are then empowered to be able to make decisions on their behalf. Because, say, for example, if somebody had an accident and they went into a coma, then obviously the person cannot make a decision because they are not, say, for example, able to make a decision because they are in a coma. So here, what you're going to be looking at is using the Mental Health Capacity Act and that framework it provides, wherein decisions could be made on behalf of that person by the family member or somebody who's designated by the court of law, and they would take into account certain key aspects, while making that decision. They would look at taking a decision which is going to be in the best interest of the person. They're going to be looking at taking decisions which are going to, support the recovery of the person from that condition. And they're going to make decisions which will allow any sort of discrimination to be eradicated, whether it's on the basis of disability, age, appearance, behavior, or the condition in terms of the patient is maybe in coma or paralyzed or things like that, which are life-threatening injuries, sometimes we call. And these things tend to be covered under what is called the Mental Health Capacity Act. Now, when we talk about the Human Rights Act, in the UK and in wider fraternity, again, here it means that, the Human Rights Act primarily was introduced in 1998, not 89. And this particular act essentially, grants all citizens of the UK, some basic rights and freedoms. Now, this act was designed by the UK Parliament to also ensure that it complies, because that has undergone an update. It complies with the European Convention of Human Rights, which is called the ECHR, and also the International Human Rights, the IHR. Now, here, the Human Rights Act of 1998 has 9 different, sections. And these sections, typically include things like right to life. That means, the state is committed to protecting the individual. If there is a threat on your life, you are not subject to any sort of torture or inhuman treatment. The other bits could be including protection against slavery or forced labor. You have the right to, your freedom. You have a right to a trial if you feel that you're being punished under the law because, unfairly, because, you have not been proven guilty, but you can challenge that. And there are other aspects of it, things like, you have the freedom of thought, religion, and your belief. You have free speech. You are able to protest. You are covered under no discrimination, so that everyone's rights are equal. You should not be treated unfairly because you have a different race, gender, religion, sexuality, and last but not the least, you have your right to privacy, and you have the right to be able to marry. So when we look at these 9 different sections, they are basically all covered under the Human Rights Act of 1998. Now here, basically in a nutshell, it means that all citizens have a clear basic right and some freedoms which are given to all people within the UK and in most countries, and this would be essentially the Human Rights Act. Now, when I say right to life, sometimes you see and you hear about clinics which are in Sweden or in other countries like Switzerland, which are end of life clinics. That means if people have terminal illnesses, in the UK, obviously the law does not allow a person to take his own life, but there are certain countries in which obviously this has been made legal. Now, when you look at right to life, that means the state is, when I say the state, I mean the government in the UK is liable to protect your life by law. And this is right to life. And this is required if there are any, say, incident or any sort of a suspicious incident which happens and that leads to a death of an individual, then the law takes its course in the sense that they will need to follow the Human Rights Convention of 1998, Section 1, right to life, and then investigate those suspicion reasons why death has occurred or why death has occurred in custody if you are in jail or if you were being prosecuted. Similarly, when in hospital it happens, and then you undergo treatments, and obviously if things go wrong and the procedures don't go as planned, and if there's a loss of life, then it needs to be properly investigated in terms of where the lapses were, who was responsible, and why this loss occurred, or why the loss of life occurred. And in those cases, Human Rights Act of 1998 comes into fruition, comes into working. Then we've got the Health and Social Care Act of 2010. This Health and Social Care Act of 2010 was essentially established, by the government to ensure that people working within any location, any premises in general, would be looking at getting, medical and healthcare services from the state or the National Health Service absolutely free. Now, this act was initially introduced in 2010 and then was revised to the Health and Social Care Act of 2010, which basically meant that accountability and autonomy was brought into the National Health Service. That means what it meant was the Health and Social Care Act of 2012 actually significantly restructured the healthcare system in England. Now, its main purpose of this introduction of this act was to overhaul the National Health Service, in the way in which they operate. And the idea was to grant NHS more autonomy over its budgets, its way of working, and competition within the system, and how private and public sector can work together was essentially introduced. Now, there were lots of key provisions within this act, and these key provisions, when we talked about the structure of the National Health Service yesterday, if you recall, the National Health Service under the Department of Health and Social Care, the Secretary of the State had various other let's say departments. So one of the key departments was CCGs, if you recall, PCCTs, which are primary care trusts, and then CCGs, which are clinical commissioning groups. And these essentially are bodies which look at functioning under the Health and Social Care Act to ensure that everyone gets what is called similar care, and there is no competition within the system in terms of providing care to members of public in the UK, in particular England. So this act has a couple of important sections, and there is an interpretation of this particular act which is introduced for Scotland, because we have devolved governments in Northern Ireland, Wales, and Scotland, and they have slight variation of this particular act implemented within their devolved nations. Then we look at the Care Act of 2014. When we talk about Care Act of 2014, it has lots of different things, and this Care Act of 2014 actually looks at empowerment, protection, prevention, and proportionality. So this is the crux of this particular act. This particular act actually looks at in general, reforming how adult social care is provided within the UK. And it was introduced to bring across a change in the legal framework of adult social care in England in particular. And the main aim of this act is to promote individual well-being. And this act actually enshrines in law how adult social care must focus on the needs and goals of the individual who's receiving care. So when we talk about the accountability aspect of it and who's eligible and what needs to be done, this act essentially put that into a bit of practice, for the members of public within the UK. So there are different sections in this particular act as well. And these sections typically also focus on safeguarding. They also focus on advocacy, information and advice, the delivery of integrated care and support, as we call it, ICS, and also any sort of recognition which needs to be provided in order to provide the care using a care worker. So for the first time here, carers were given the same rights as people they care for. That means carers can also request for an assessment of their needs, and they might also be eligible for support rather than just the patients being eligible for it. And that is what was covered under the Care Act of 2014. Is that okay? So that, helps us cover. These are legislations that you need to understand, which are related to the health and social care sector. There's a handout that I have, which will allow you to study them in a bit more detail. And my suggestion would be to primarily go through this for the purposes of understanding. And that would be, the task for, 2.2 criteria. That would be basically the criteria, 2.2. Is that okay? Any questions on this? So 5 acts in particular that you have to be aware of: Mental Health Capacity Act, Health and Social Care Act of 2012, Care Act of 2014. We are looking at the Human Rights Act of 1998. And then last but not the least, the Equalities Act of 2010. Now that brings us to the third assessment criteria, which is basically looking at describing various sources of information that we can get to understand the concepts of equality, diversity, and discrimination. Now here, this is something that we need to be looking at from a point of view of looking for information. Where can we get this information coming across about equality, diversity, and discrimination? So if you think it this way, now, who creates the laws in the country? In any country, if you look at who creates the laws in any country.
The Parliament.
That is correct. So if I now look at drawing a bit of a mind map, we start with the Parliament on the top, which basically introduces laws, legislation. From the Parliament, where does it go within the National Health Service? From the Parliament, it goes to?
It goes to the executives, or?
Absolutely.
Maybe.
So it goes to, say, for example, in this case, if I just correct you on that, just slightly refine it. From here, it goes to the National Health Service, but before that, it goes to the Department of Health. So under this Parliament, when we look at from the Parliament, what we generally see that the laws which are created would then be taken into account from a point of view of going into Department of Health and Social Care or various departments. If there was a law introduced for policing or something else, it'll go to the relevant department like Home Office. But because we are talking about just the health and social care sector, what we want to do is understand and draw up a bit of a flow chart in our minds. So from Parliament, that particular thing goes to the Department of Health and Social Care or Department of, Secretary of State for Health and Social Care, and that is the Department of Health and Social Care. From there, where does it go to? This law, which has been created, the Department of Health and Social Care will interpret it, pick out the golden nuggets from it in terms of what is applicable in this sector, and then put out policies or procedures which would then be made available to different agencies or organizations which work within this sector. So this is like decoding the law or the act and then interpreting it. Why is it useful for health and social care users or organizations or various departments within this particular sector? So they will create policies, they will create a white paper, they will create procedures, they will talk about, implementation plans, and they will then be shared with the NHS England, the Higher Education, Health Education England Board, the Public Health England Board, and some of the bodies or regulators like CQC, the King's Fund, and they will further interpret and then filter it down to how this would be put into practice. And they will then, the implementation of that would be given to clinical commissioning groups, which will then pass it on to the hospital trusts, the surgeries, the pharmacies, things like that. So it's like saying, if I give you a simple example, if you have a policy in the college which basically talks about safeguarding, where would we have got that policy from? Safeguarding Act of 2014, which is introduced by the government. That would have been coming to the Department of Education, DFE, Department of Education, giving out some guidelines which will go to OFCall, which is the Office of Qualifications, which authorizes awarding organizations, would then give out an interpretation of how this law and act can be incorporated into education. They will send it to ATHE and some of the other awarding bodies. ATHE will create a template which will be related to their course and their structure and how they will deliver and incorporate this in the qualification. Then they will pass it to the college. The college will look at that draft of ATHE's policy, and on the basis of that, we will create our policy. So as you would see, the source of information started from the Parliament, went to the department, relevant department. So in this case, Department of Further Education, then coming to OFCall, which is the body, then goes to the chartered body, which is the body which writes the qualification. From there, they circulate a template, it goes to the college, we adapt it, and then we put it out on our website, and learners would look at following that as a guidance. So this as a process will follow through by decoding, in a way, the law legislation. But the sources of information, if I read the legislation which was introduced by Parliament, it might not make sense to me. So what I need to do is decode it, and that information which has to be decoded into a simplest form, which is applicable for me, usable by me, would be done at the college, and that would then be used on a day-to-day basis to protect individuals from any harm, like abuse, say for example, bullying, and that would be considered under, just as an example, safeguarding. So similarly, if we look at how sources of information, advice, and support are provided about equality, diversity, and discrimination, this is how you would generally see that happening within the NHS or within the National Health Service. So at some stage, this law and legislation will come to the NHS trusts and hospitals. They will create what are called company policies and procedures. So there will be a policy on equality and diversity, there will be a policy on safeguarding, there will be a policy on discrimination, and that would be a relevant document which is working within that organizational setup. So if I talk about Manchester, there would be a policy of safeguarding discrimination, equality, and diversity within the Manchester Infirmary Hospital, within Shaw Hospital, which is owned by the same trust. Then I go to Bury and Bolton, owned by the same trust. And this piece of document, which is seen working and implemented within the hospital, departments, would essentially be the source of information that people, when I say people, I mean staff, employees, contractors, and patients would have, because they can then see this as a piece of documentation being implemented and running it on a day-to-day basis. Is that clear? Yeah. So here in this task, what we have to do is describe the sources of information. Where do you get information on, or advice on, or support on the three topics of equality, diversity, and discrimination? So they will come from company policies and procedures. They will come from government documentation, or information from government website, leaflets, flyers, information which is circulated by the government through maybe advertising, things like that, and some key agencies which are going to work in favor of the customer, or in this case the patient. And these key agencies would provide this information free of cost. That means their role would be to propagate this information so that customers and patients are aware of it, and they would be coming from advocacy groups, the Citizen Advice Bureau, or it is called the CAB, as you would understand. It'll come from regulators like Quality Care Commission. It will come from various other agencies which are working in the context of promoting public health with the use of equality, diversity, and eradicating any discrimination which could happen if people are not aware, or if they are not trained, or if they do not have any sensitivity towards these topics. Is that okay? So if I have to look at what are the sources from which this information will come, it'll come from government agencies. It'll come from, even from charitable organizations like Christie's Hospital, Macmillan, because they would be promoting some part of this information free of cost. and in the interest of the public, because they have no selfish motives or profits to be made from there. Their aim is to promote and propagate this information so that every individual, every member of the staff, every member of public in the UK gets equal opportunities when they are receiving the same amount of care when they do need it from the National Health Service. And this could also come across from community-based organizations, which could be local community groups that we get to see under councils, and they would be looking at promoting information. One of the recent things that you would look at in the last few years has been the promotion of LGBT rights. A lot of work has been done by the government and various agencies, charitable organizations, advocacy groups, and they have published a lot of information on this to make sure that people who have and believe in these and are classified, and then they group them as LGBTs, they are able to get accepted in the society. And that is where, what you have to highlight as far as this aspect is concerned. Is that okay? Any questions on this? Okay, let's look at the last assessment criteria, which is a distinction criteria, which talks about how do we assess the effectiveness of national initiatives in promoting any anti-discriminatory practices which we can see within the health and social care sector. So here, what we are looking at is talking about how does the government, the policy, the legislation, the acts, and various processes which are introduced help in dealing with discrimination. So one of the first things that you will look at is talk about legislation here. So take examples of legislation like the Equalities Act of 2010, the Equalities and Disability Act, and then talk about this in a bit more detail to explain how this act can be used essentially to, ensure that no individual is facing discrimination or unfair treatment in a workplace or in wider society, in particular and within the health and social care context, receiving the same treatment or fair treatment from the National Health Service. And this would allow you to talk about the 9 characteristics that we covered, like age, disability, gender, marriage, race, religion, sex and orientation. And that would help you to show that how does the government actually position and use the Equalities Act of 2010 to root out any anti-discriminatory practice which could happen, or which could be used to basically not provide fair treatment to people or patients within the National Health Service. This is one such example because it talks about assessment. So you need to be able to put arguments which are going to support it. And that is why you need to discuss maybe one of the acts in a bit more detail to show how it will help in promoting anti-discriminatory practice within an organization or within a setup. You could also talk about training and education. We could also talk about, impact of legislation is what I've explained. And what the CQC does is, as a regulator, as an independent regulator, it upholds and monitors, and it goes to various organizations once in 4 years to inspect them. And the inspections essentially are done to ensure that these policies and these legislations which are introduced to promote equality, diversity are not just on paper, they are actually implemented within a setup so that there is no unfair treatment or no discrimination which is happening to patients when they are receiving care. You could also talk about policies and procedures within the organization which are there. You could also talk about training and education programs which the government runs. There are campaigns on the national level which the government runs, like the anti-discriminatory campaign which the government has run in the last couple of months. When we had the LGBT rights and the bill being passed in the Parliament a couple of years earlier, there were lots of campaigns or advertisements, billboards, and other bits done to educate the members of public to be tolerant towards this particular group and accept them into the wider society. And that would be a case in point that you would need to discuss with regards to this assessment criteria. Is that okay? Any questions on today's discussion so far? Any questions? So what I'm going to do is basically look at providing you a bit of a handout. And this handout would cover, the basic parts of the legislation that we need to look at today from a point of view of, main understanding of the learning outcome. And this particular handout that I will provide will essentially give you the detailing that we are looking at, for maybe going into absolute crystal clear details about, the acts that we need to be able to know. So these are the acts that I would essentially, provide as a bit of a handout, which I will drop, shortly just on the, WhatsApp as well, and it will be available on Moodle. And this should allow you to, build a bit more understanding as far as, the learning outcome 2 is concerned. Is that okay?
Yes.
Good stuff. So we will now meet next week, Monday and Tuesday, same time at 11 a.m. to discuss learning outcome 3 and learning outcome 4. Until then, my session would be to look at this particular handout, which I'm showing you right now, and then another handout which I have, which is the case studies handout that I've shown. And this is another bit which I'm going to provide to you, which is basically a quiz. Now, this, once you've gone through the handout, my session will be to go through this particular quiz. There are 4 or 5 questions in this, but it will help you clarify some of the areas that we've discussed, like equality and diversity, what are the key legislations around it, and then how do we look at information advice and support, and then what are the national initiatives which the government is taking into account to promote, anti-discriminatory practices. So this is like a bit of a revision, for you, wherein you basically look at the question, answer, and choose the right choice. The answers are also highlighted, and they would help you, summarize and revise what is the, the requirements for the learning outcome 2. Okay. Good stuff. So what I will do is now bring an end to today's discussion. And what I will do is catch up with you with regards to this particular unit next week. Till then, go through some of the stuff which I've explained and I've provided, and hopefully that should help you develop a bit more knowledge on what we've discussed with regards to this particular session. Thank you for attending. Bye for now.